It's another day with your fertility specialist. On behalf of Alps Hospitals, we welcome you all to a very interesting episode of A Day with Your Fertility Specialist. I'm your host for today, Ruth Ogogo, and I'm sure you're going to have a good time with us today. Today, we'll be talking about recurrent miscarriages and the investigations that matters, what people need to do. So right now, as we start, call up someone, share this link with someone. If you know someone that might have been dealing with recurrent miscarriages and they don't seem to understand why it's happening, please, this is the time for them to get some new insights, new information, some breakthrough just to deal with what it is that they are going through. You cannot just tell, you never can tell whether this might just be the game changer for them. So please share this link, call up someone. If you know you love someone out there and they are going through so much, what you can do for them right now is to make them connect to this session so they would have every information they need to thrive and get the best out of whatever it is that they are going through. Feel free to drop your thoughts, your comments, and we'll definitely respond or attend them. Today we have Dr. Deborah Ulubi to take this topic with us today. Dr. Deborah, it's good to have you.
Thank you very much. Always a pleasure to be here. Good afternoon, viewers.
So, for the sake of someone watching here, I know a lot of our viewers are familiar with Dr. Deborah, but for just the sake of that one person or people that are joining for the first time, a bit about Dr. Deborah. She's a family physician. She's an IVF specialist and also a fertility specialist. She's also the head of IVF department at Alps Hospital. So that's more like saying every information you need to get about IVF, you're seeing her right now. So yes, if you still have questions that you could still drop that and we could still respond to that as we go on. But for now, let's talk about what we have for today, which is recurrent miscarriages and the investigations that matter. So, Dr. I'm sure someone might be wondering, or people might want to know, what do you really call a miscarriage? Because some people will say they they tested positive, and the next time maybe when they are having a scan, they're like, but pregnancy test was positive, and then some people might just wonder, is it really a miscarriage? The pregnancy even happened, or why did it test positive and now they are not seeing anything? So, what do we really call a miscarriage? I mean, in this is your field, clinical terms now, how do you explain what a miscarriage is for people to know?
Okay, so a miscarriage is when a woman loses a pregnancy. That means the pregnancy is no longer viable. That means something happened that puts an end to that pregnancy. And then usually when you have a miscarriage, there are some symptoms the client presents with. For
Okay.
for most people, you don't usually have any pain, but they just notice that they are bleeding per vagina. So vaginal
Mm,
bleeding. Yes,
mm,
some could have with lower abdominal pain. So that's when you say there's a miscarriage, but there are some terminologies like missed abortion.
oh, okay.
Yes, that means the pregnancy is no longer viable, but the baby has not been expelled, or the concept embryo has not been expelled from the body yet.
Okay,
So it's
okay.
like a hidden miscarriage.
Oh,
But
okay.
when you have a miscarriage, it's usually obvious. What we're talking is usually obvious because there's bleeding. Once a woman is pregnant, for the duration of the pregnancy, you don't expect any vaginal bleeding.
Bleeding.
Yes. So when you see blood, there's definitely something happening. And when we talk about a miscarriage, we can have threatened miscarriage.
Mm,
When the person is checked and the fetus or the baby is still viable, the
survival.
pregnancy
Okay.
is still viable. But when the
Mm,
pregnancy is no longer viable, and all the product of conception is out
coming
of the
out.
uterus,
Mm,
and that's a complete miscarriage.
mm. Okay, that means some can be incomplete and then they might have to do.
And yes, a
Oh, okay.
procedure to complete it.
Oh,
Yes.
okay. So viewers, hope we know that. Yes, well, as much as we're talking about miscarriage, it's not the time to start saying these are the various types of miscarriage, but what is involved here is most times in miscarriage, the fetus is lost.
Lost,
Yes,
pregnancy
within the
loss, yes.
first 20 weeks or so
Life,
of
yes.
pregnancy. Yeah. Okay. So I know we're talking a lot about investigations, but before that, let's even know what are the possible causes of miscarriage that people actually deal with, because sometimes like, women actually go through a lot. Just hear a woman say I've had miscarriage 5 times, six
Yeah,
times,
so that's
seven
that's what we're
times.
talking
It's
about here.
really
Recurrent
worrisome.
miscarriages. Yes, if
Wow.
a miscarriage was just a sporadic thing, maybe once, you're not
Yeah.
really bothered. But when a woman
Mm.
is having up to two, so we're looking at recurring miscarriages when a woman has had two or more consecutive, early pregnancy
Mm.
losses, like you said, usually before 20 weeks of
Of
gestation.
pregnancy.
Yes,
Wow.
that is worrisome because you want to probe to know what can really be causing it. And there are lots of causes for it, but one of the major causes is when there's chromosomal abnormalities. So
Okay.
when this embryo is not compatible with life, so
Mm.
nature, knowing that this embryo, will give rise to a fetus that's not, or a baby that is not compatible with
With
life,
life.
nature tries to
Eliminate
remove.
it.
Yes, so a
Mm.
miscarriage happens. So a lot of miscarriages is due to these chromosomal abnormalities. There are other causes like when you have anatomical issues in the
Mm.
uterus. It's the
Okay.
uterus that houses the pregnancy.
Yeah.
So things like fibroid, especially submucous fibroids,
Mm.
fibroids just below the lining, the endometrial lining, that changes the anatomy and changes the operations of the womb. So that predisposes people to having recurrent miscarriages. Then other issues like polyps. Some people have abnormal growths in the lining of the womb. That could also predispose to recurrent miscarriages. And
Miscarriages.
then
Wow.
some other congenital anomalies.
Mm.
Yes, some people
Wow.
are born with some congenital anomalies of the uterus, like a septate uterus. You have an abnormal division or septum in
Uterus.
the uterus, reducing the capacity of the
Uterus to
endometrium.
carry.
Yes, that
Oh.
can predispose,
Hmm.
to having recurrent miscarriages, and that's one
Miscarriage.
of the most common congenital anomalies in the uterus that could
Hmm.
lead to that. Other congenital abnormalities like bicornuate, unicornuate uterus can also predispose a woman to having recurrent miscarriages. Then when you have some hormonal issues, people that have thyroid abnormalities,
Oh.
hypothyroidism,
Hmm.
some people have diabetes, endocrine issues like diabetes, uncontrolled
Yeah.
diabetes,
Hmm.
that predisposes a woman. Also, when you have issues with like hyperprolactinemia, these are all hormonal issues. All this can
Yeah.
predispose a woman
Hmm.
to having recurrent miscarriages. Yeah, so those are some of the issues. There are a lot of other things. There are a lot of other things. For example, lifestyle can predispose
Those
someone.
people. Oh
Yes,
wow.
someone that
Hmm.
takes excessive alcohol, someone that smokes.
Hmm.
Yes, even someone that's very obese. All that can predispose someone to having recurrent miscarriages.
Miscarriages.
Yes, so those are some of the causes of why you have recurrent miscarriages.
So, viewers, Dr. Debbie has given us a very long list of possible things that actually could cause miscarriages. And I believe that if you're watching this right now, there's something to pick from these various causes. And then there's an explanation to why you might have actually be going through recurrent miscarriage. And that's why you don't just sit back and just say, some people say they will just sit back and maybe keep faithing
And
it
keep hoping that
one,
the
and
next
yes,
one will
the
stay.
next one and all of that,
Yeah.
and then it keeps happening. Then you are seeing it happening five, six, seven.
Mm.
I've even heard of someone that's had 10 times. I'm like, wow, this is a lot. And then I mean, there's just something about miscarriage. A woman's having one miscarriage, there's just, I don't know how you're
The
able to recover from it.
Yeah,
Then
the
going through
emotional,
two, three,
yes,
four,
trauma. A
that's
lot of
really
people
a
fall
lot.
into
And
depression,
all of it's a
psychological
lot.
issues, emotional issues, the
Yeah.
emotional trauma. One shouldn't wait till you're having more
So
five,
much,
6, 7 before you
yes, you
try
should
to
seek
find out
explanations
what
for
is
what you're
happening.
going
Yeah.
through. So okay, well, um this is you've given us some of those causes. Some people would wonder, how do I get to know? Because there are also some people that maybe there are some people that they might have told that, okay, maybe it's something with the cervix. Maybe they are trying to tell them that, okay, maybe they are explaining that why you're having this loss, maybe there's something with
Cervix, yes,
the
there's something called cervical incompetence, but
mm,
that causes recurrent miscarriages later on in pregnancy, usually mid trimester,
mm,
towards in the second trimester, towards the end of the second trimester. So that's the cause of the late miscarriages later on. But when you're talking of recurrent miscarriage. Most miscarriages happen in the first trimester, like we said, before 20 weeks gestation. That's the early part of the pregnancy.
Second
That's when
trimester
most miscarriages, yeah,
happen.
yes. But cervical incompetence is a cause of miscarriages happening later on in the pregnancy.
Pregnancy.
Yes,
Okay, so viewers, hope we are noting that, so that even when they give you some of these diagnoses, you make sure you are getting the right care from someone that is well knowledgeable, and so they are able to tackle whatever it is that is has been identified and it could be addressed. Well, so now what are some of, I know that you see a lot of people that have actually had this history of recurrent miscarriage. What are some of the investigations that you would want to do, or yeah, you want to check to
yeah,
know that what could be the cause, because they are seeking answers to their questions.
definitely,
Why is it
yes,
happening?
yeah.
I mean, I thought the first one was just this, but this one I didn't stress myself, so why is this still
Yeah,
happening and
people
all?
attribute
You took,
stress to it and
yes,
all that. Yeah,
exactly. So
yeah, but recurring miscarriages usually have a cause most times. So there are some times that you investigate, do tests, and you're not really able to pinpoint a cause, but for most cases you're able to find a cause. So for a woman that has had recurring miscarriages, you want to take a history, find out at what age of the pregnancy
oh,
are these miscarriages happening, if there were any other
mm,
events associated with it. You also want to take a medical history. You want to know if she has any medical issues, she diabetic,
mm,
she hypertensive, any family history of suggesting anything. And then when we talk about investigations to do, usually want to start with the common, easily accessible investigations.
mm,
So one of the first things we want to do is a transvaginal scan. A scan to just look at the uterus, look at the lining, all that can give an idea. We talked about anatomical problems, issues with the uterus. She has submucous fibroids, if she has polyps, if she has congenital abnormalities in the uterus, like the septate uterus, if she
yeah,
has even intrauterine adhesions,
mm,
which you could see the lining looking scarred, that could be a pointer. So from that scan now, that could make you want to do further tests to further evaluate that uterus better, especially if you are seeing something. So
yes,
there are different tests you can do to further evaluate the uterus. You could do a saline histography. This
okay,
this is better than just an ordinary scan,
oh,
because that will help to better outline any abnormalities in the
in the
cavity of the
uterus,
uterus.
oh,
She could also have a hysteroscopy. So an hysteroscopy is beneficial because you don't just make a diagnosis, you can also
yeah,
treat
mm,
at the same time. So
okay,
if there are polyps, the hysteroscopy involves direct visualization of the inner part, the lining of the womb. So if you see a polyp, it can also be treated and removed at that same sitting. If
mm,
there's a submucous fibroid, that can also be removed. If there are intrauterine adhesions, that those can be also dealt with at the same sitting. And if there's a septum, an abnormal septum, it can also be treated. So you can see that hysteroscopy
it could be
offers two
diagnostic
benefits, yes,
and
both diagnostic
operative,
and therapeutic, and
mm,
administer a treatment.
okay,
So those are some of the things that you can do. And then also you can do some blood evaluation. We talked
oh,
about
okay,
hormonal issues like thyroid abnormalities, diabetes. So these are blood tests that you
yeah,
do to detect these various conditions.
mm,
There's even something we call antiphospholipid syndrome that also leads to
okay,
recurrent miscarriages. So those antibodies can be detected with a blood test. So a blood
mm,
test can help to detect all that. And then if you want to go further, you can do genetic studies, karyotyping. We said genetic abnormalities are also a cause. Genetic abnormalities in the fetus I said that is chromosomal abnormalities,
yeah,
in the fetus, in the embryo, is one of the commonest causes. So although we don't usually do this because of the it's not a routine, something commonly done, but it can be done maybe
mm,
because of the cost and the product can
yeah,
be tested for any of
what
these
the cause
chromosomal
could be,
abnormalities, yes.
oh,
And even the parents, that's the husband, the wife, can be
yeah,
tested for some of these things, so that you know that if they have a predisposition, they have some of these things, there's a high risk of them transferring it to the
yeah,
to their gametes and then to the embryos.
mm,
You can then counsel them for other things they can do, maybe the use of donor gametes, or they do pre-genetic implantation testing.
oh,
That means they
okay,
might have to have the gametes can then be tested for any of these chromosomal abnormalities, so that you don't transfer gametes that have this predisposition, so that
okay,
healthy embryos without aneuploidies, and all these chromosome abnormalities are transferred. So those are some of the testings you can do. And then there are other causes like um, luteal phase defect.
Oh,
Yes,
okay.
hyperprolactinemia. So these are
Mm.
hormones that you can also test for, and then treatment can be, when you discover all of these things can be treated.
Okay, so do you feel, some people would say that, I'm sure that you've had some clients that will tell you that, they said I had infection and that was what caused the miscarriage,
Marriage.
and then they will not say, but we treated the infection and the miscarriage is still happening. Well, do you feel that infection actually could be
Cause
cause
miscarriage.
miscarriage? Yeah.
Yes, definitely infections can cause miscarriage. Even something like malaria can
Oh.
cause miscarriage,
Hmm.
yes. But as a cause of a recurrent, we're talking about recurrent
Yeah,
miscarriages, a
it's
woman having
true.
2 or more consecutive miscarriages. Yes, something like malaria might not necessarily cause that. Infections are lower down as a cause of recurrent miscarriage, but some infections can cause, especially the touches complex infections such as toxoplasmosis, cytomegalovirus, herpes simplex, syphilis, all those infections could cause
Infections. Wow.
recurrent miscarriages if they are not treated.
Okay, so viewers, a lot about, I was just thinking, I've seen someone that's um has had recurrent miscarriage, and maybe after investigations
Yeah.
done, they are saying there's a problem with either her egg or her
Good.
sperm.
Yeah.
So at that point, when you see such people, what do you prefer now to them? Because now, or on another way, I there was also this there's this couple that I've been following online, and then seeing some conditions. Some people might have something that they feel they are not aware because it didn't manifest in them. Like, okay, as a man, the man has something in his gene that is not manifesting, and then the woman has something in her gene that is not manifesting. Then maybe both of them meeting together,
They now
and then
express it
yes, and then
in the
so in
gametes. Yeah.
such cases now, if they now get to discover that, okay, there's just something with both gene that is better, you for maybe take out one of the gametes.
Gametes,
What would be the way out for such people that might maybe have had, that the body keeps, maybe as they keep having pregnancies, the body keeps discarding the babies, like having
okay,
miscarriage and
yeah.
all, because apparently they feel the babies are not compatible with
With
life.
life,
Yeah, so
yes.
what would be your counsel, or what solution would you prefer to such people? What would be the best bet for them to
To
achieve
do. Okay.
pregnancies
So,
possibly?
like you said, one of the ways would be to remove one of the gametes. Somebody opts or volunteers to take a donor gamete, either donor
Mm,
sperm or donor egg, and then the
okay.
other partner will use their own gametes. Or if they don't want that, then they do pre-implantation
Okay.
genetic testing. So that means they would have to have an IVF. When embryos are generated for them, these embryos are all tested. I know it's something like this we do with ASAS mismatch. If you still want to use your gametes, pre-implantation
Mm.
genetic
Oh,
testing
oh,
is
yeah,
done
yeah.
to eliminate those embryos
That are
that have
normal and donor.
SS, genotype.
Okay.
Yes,
Mm.
exactly. So the same thing will be done so that all these aneuploidies,
Will be
can be, yes,
checked.
any of the gametes, embryos that has that
Yes.
won't be transferred for a pregnancy to happen. So that's what they can do. And if or else one person takes a donor gamete,
Donor
that's
garments.
the best way to approach it.
Okay, so also another, like I was going to ask, what further investigation could be done for the man's sperm, because
Okay.
I think maybe their general sperm might show some structural abnormalities and all,
Definitely,
but
yes.
are there
Because
some further?
that's why we say that women that are more advanced in age, the chances of miscarriages are higher in them because the
Oh,
chances of chromosomal abnormalities in the
oh,
eggs,
it's
are higher,
high.
even for men that are well advanced in age. So
Mm,
other tests you can check to check the integrity of the
the
sperm
sperm.
is by doing a DNA fragmentation index. You can do
Oh,
that test,
okay.
yes. And if the index is high, then that shows that there's a problem with the DNA makeup of strands of this sperm.
Mm,
That kind of sperm might fertilize the egg. They
yeah.
might even generate embryos. Embryos might start to develop, but
It
development
gets
can be arrested
arrested.
along the way, and they can likely lead to the miscarriages we're talking about.
About, oh
Yes,
wow. So it means that as a man, it's not just okay to say I've done seminal fluid analysis and
yes,
they said
yes.
it's fine, so the problem, it has to be my wife.
Wife
You don't
swapping.
just assume that. We also have to check further. And even at that, I mean, Dr. Debbie has let us know there are some further analysis that could be done on the embryos to check for the
Definitely.
normal and the abnormal ones, and then
Yes.
possibly if you have to have an embryo transfer, the normal ones
Will be
would be
transferred.
transferred, and we hope that the pregnancy progresses well. So for those people that are diabetic and they are having recurrent miscarriage, is there a possible way? Because some of them, is it maybe their sugar control, or like, okay,
Yes,
so
poor sugar
is there,
control.
so
Yes.
that means there's hope for them if they
No,
are able
definitely
to.
there's hope for them because
Mm.
for a lot of people, they are usually maybe undiagnosed.
Oh.
Yes, this
Mm.
was something that I was just presenting. They were undiagnosed, so it's when you evaluate that you now realize that, oh, this person has diabetes.
Yeah.
Yes, so
Oh.
and once the sugar is properly controlled, that issue is sorted out. So it's
Mm.
just for them to be properly, sugar to be properly controlled, not
Controlled
just with drugs, lifestyle change and all that.
and all that.
Yes,
Mm. I
and that
actually,
pregnancy is properly monitored, monitored properly.
so I know of someone that actually had an IVF. So when she had an IVF, I think it succeeded quite all right. By 6 weeks, the scan was good. By the time she came for the next scan, they couldn't find the heartbeat of the
Beating.
babies anymore. I think it was twins. And then at that point, I think they did further
Testing,
investigations,
yes.
and then they discovered that her sugar level
She
was
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 diabetic,
high.
and that was she was newly
Yes,
diagnosed. Yeah,
yes,
yes, yes.
exactly.
So it usually happens more in a scenario of someone that didn't know they had diabetes.
Mm,
That could be the way the diabetes is
for
presenting.
them. Mm.
Yes, so that's why you see that as part of antenatal
Investigations,
investigations,
yeah,
the blood sugar of clients should be checked.
checked.
Yes,
Mm.
because that might be the opportunity to detect it. So
It's
blood sugar
true.
should be checked, and that's why you take a history. People that have family history of diabetes, you should pay closer,
Attention
attention
to
to them.
them.
And we know that there's something called gestational diabetes
Mm.
that could come up, as a result of pregnancy. Mm.
Okay, so viewers, I know that a lot have been learned from investigations that are required in the course of pregnancy, or as investigations required when you have recurrent miscarriage. What would be your counsel to couples that maybe they've done all investigations and they've told them that everything is fine,
Yeah,
everything is normal, and
yeah.
then yeah, they are still dealing with this.
Yeah,
So
well, everything is normal within
the
within the
scope of
scope of what we have available to us to detect.
mm,
There might be some subtle issues that
issues.
the test might not really be able to
Peak
bring up. Even something like this DNA, someone that has a high sperm DNA fragmentation index.
fragmentation,
If
yeah,
you don't do that test, you might not know that that is where the issue
issue
is.
is coming
Yes,
from.
but for clients that have been told that hope is not lost, all hope is not lost. We've seen
Mm,
people with recurring miscarriages that still carry a pregnancy to term and have their baby. So, but that pregnancy needs to be properly monitored in a
monitored.
proper facility by specialists. There are lots of things we can do. The fact that you've not made a diagnosis, but there are some precautionary things you can put
Can
in
be
place
done.
to
Mm.
further safeguard this
The
pregnancy and prevent a
pregnancy.
miscarriage.
Hmm.
You can place, some of them can have progesterone,
Oh,
other
okay. Hormonal
medications,
support.
yes,
Oh,
other medications that can further support the pregnancy. And then you know that this is like a high risk pregnancy, so you monitor them. You give them shorter appointments, and then they are closely monitored, and a lot of them get to carry their pregnancies to term and deliver their babies.
mm.
So all hope is not lost.
Yes. So,
Yes,
what do you say to people that are actually dealing with PCOS and recurrent miscarriage? Because
yes,
it seems
yeah,
to be something common with them, and then
yes.
they just wonder, is there really something they can do to actually manage
Yes,
the
a lot can be
situation?
done because PCOS, the challenge with PCOS is poor quality eggs. And we just said
Mm,
poor quality eggs will birth poor quality embryos. And these are embryos that you can't guarantee if they would continue to progress. So development can be arrested at any stage, and then miscarriage can happen.
happens.
So one first thing is to deal with the PCOS, the hormonal
Mm,
abnormalities involved in with PCOS. Those things need to be corrected as much as possible. Some
possible.
people could have laparoscopic ovarian drilling. That's another way we get to correct the abnormalities. And then they are also placed on a lot of support, hormonal support, and so on. So
To
all that
support.
helps to improve the prognosis for them.
So, for someone dealing with PCOS and has had recurrent miscarriage, all hope is not
Lost,
lost.
yeah,
Yes, all hope is not lost. As much as there is no cure, but for management's sake, you
yeah.
could manage to have better outcomes of pregnancy. Okay, so as we wrap up, What's your counsel to people generally that maybe have been victims or are still victims of recurrent miscarriage?
Okay.
And yeah, just your counsel to them generally and how to manage it
Okay, so
generally.
my counsel is to seek help, seek medical attention in a proper place with good, special qualified specialists. It's not
Yeah,
just going anywhere.
exactly.
The hope is there's a lot that medicine, science is doing
Offering,
nowadays.
yeah.
Yeah, so it's just to seek help. Don't keep hoping and keep hoping and staying at home. Seek help at the right place. There's help. Yes, there's
Yes,
hope.
yes, exactly.
Yes,
There's help. They said, how do they put it that a living dog is better
better
than a
than
dead lion? Yes.
yeah.
So
Yes,
yes, there's hope. There's
yes.
once there's life, there's
There's hope.
hope.
Yeah.
Yes. You don't give up. I know it's a difficult thing for someone to even go through. At
Mm.
least I've experienced somebody that went through one miscarriage. I know how she even struggled to
Mm.
through that. It was a very difficult time and all of that. Then not to talk more of someone that actually goes through
Two or more.
two or more. I mean, that's a lot.
Yeah.
It takes a very big toll on the woman, on the family as a whole. And I know that you're struggling with a lot out there, but we hope that somehow, some way, very soon you're able to find some help that would actually help you carry pregnancy, so that whatever may be the cause, it could be addressed, and whatever solution it is preferred to you, we hope that you are able to embrace that solution to be able to achieve pregnancy that will stay to term. Dr. B, thank you so much for
Thank you
today's
for
session.
having me.
Thank you, viewers, for engaging us, for staying glued to your screen. I hope that someone has been able to grab something with respect to recurrent miscarriages, investigations to be done, and possible ways to manage it and prevent further recurrence. So we hope that somehow, some way, you're able to find help and achieve pregnancies that will stay to term. Thank you so much, viewers. It's been good having you guys. We look forward to seeing more of you in our next session and more sessions to come. Please always stay glued to your screen. Look forward to our notifications, like our posts, watch our videos, and we'll be happy to see you in our next session. But for now, have a lovely evening. Bye.